Hyperpigmentation is one of the most common skin conditions throughout the world. And though the condition is common and usually harmless, it does cause patches of skin to become darker in color than the skin surrounding it, making it more difficult to get that clear skin that we're always looking for. Today's experts on the show will help us understand hyperpigmentation as well as effective ways to treat it. So glad that you're joining us on the show today. My name is Joey Muthengi, and this is the Skin Therapy Show. Let's get started. Really excited about today's show. I think there's a lot of information to be gathered here. So I'm seated here with our guest for today. So excited to be here. Karibu sana to the Skin Therapy Show. We'll start with introductions. Maybe you could tell us your name, a little bit about yourself, and what it is that you do here at the LCC.
I'm Pooja. I've been in the wellness industry for over 15 years now.
Wow.
Yes, I'm a wellness consultant and a skin cosmetologist by profession. I've been with VLCC in Nairobi from 2014 is when we started, and we had the First Lady here to do the honors.
Wow.
Yes, it's been a privilege. And elsewise from India, I come with this career from India. I'm lucky to be in a career which is also my passion.
Yeah.
Yes.
15 years in wellness.
Over 15 years.
So you're well yourself. You must be very well.
I try to be.
Yeah.
Yes.
So today we wanted to talk a little bit about hyperpigmentation.
Yes.
And I'm going to have to pace myself on saying that word. But maybe we can start by defining what that is, because a lot of people just think it's, oh, I have some dark spots, and there might be a difference between the two. So maybe just let's start by defining what it is.
Yes. As a layman, you can say dark spots, but hyperpigmentation is of three categories. We have 8 spots, which generally okay, let me tell you what hyperpigmentation actually is. It's about producing excess melanin in your skin, and because of the overproduction of the melanocyte cells, they begin to show up on face or other parts of your body. And of course, it's not a disease, but it is a skin condition which needs to be tackled as early as possible.
Yeah.
Yes, so they can be of various types and kinds, various age groups, and most of them, like one of them called melasma, affects the ladies and the females more.
Okay.
So to begin with, age spots is mainly affected for the older people. It's like the dark spots you say, but it can be anywhere on the body. Yeah. Depends. We at VLCC is where I'm working. It's a wellness center, and also we have solutions for skin. I try and identify the scope of the treatment, what it can do for your skin, and try and analyze it. From there, we want to see how we can treat the area of concern.
Right.
So there are various treatments. The level and the intensity of the condition can vary. So we cannot just as a layman just say you use this over the counter. Yeah. So
right, we'll get to the treatments in just a moment, but I just wanted to know, how common is this, or how often do you see people coming in and saying, I have some dark spots?
Joy, it's very common, but a lot of people misconstrue it with a suntan or a sunburn, which people are not aware of. Right. For younger ages, it could be a skin injury where we keep scratching and it gives you a scar. So those are post-inflammatory hyperpigmentation, which I was coming to. Okay. So there are various kinds. So if it's dealt with at the earlier stages, we do not have to do so many treatments on that. Yeah.
Right. What are some of the causes, would you say? Is this something that,
yes,
genetic?
Genetic could be the melasma part of it.
Okay.
Melasma is also a kind of hyperpigmentation, which is also called as mask of pregnancy. It generally happens at that stage.
Okay.
Because you're taking birth control pills, and once you stop those, it sometimes goes away by itself.
Oh.
Yes. So, yeah.
How is it that you assess because you're saying there's different types? So how is it that you
Yes,
assess?
so that's why when our client walks into VLCC, Joey, we have various ways of analyzing. So I'll also show you how we do that. We try and understand their lifestyle, how long back they started to watch over themselves and this thing coming over their face or any other part of the body.
Yeah.
So we try and understand and then we go from there. Also the video dermoscope that we use in our center gives us a fair idea about what treatment to do.
Yeah. And you just mentioned it could be, a lot of times we think hyperpigmentation is just something that happens on the face, so it can happen on the body.
It can be anywhere on the body, especially the age spots part of it.
Okay.
Melasma is mostly forehead, it will be a very strong darkness there, yes.
Are there certain skin types that are more prone to hyperpigmentation?
Yes. Like Muzungu that you call, or a very fair skin, are more prone to sunburns.
Okay.
Unlike us who are more prone to suntan. So that's also a condition. So a burn can lead to other things, in the change in the pigment of your skin if it's not cared for in the earlier stages.
Yeah.
Age spots happens more for darker skins. Yes.
Okay.
More for darker skins.
So at which point does someone say, okay, this is looking like something I should go get checked out? Because you could just say, oh, maybe something happened, maybe I got the sunburn, like you're saying, and it's going to go away. But at which point should they seek your help?
Even sunburn or your suntan, they're all conditions of disturbance in the melasma of your skin. So either it needs to be protected with a sunscreen with a good spectrum, or if you feel you need a quicker remedy to it, which is of course treatments. Products generally try and protect and maintain your skin. They by themselves will not treat your skin. That's the difference, and a lot of people do not know we start aging after the age of 25.
25?
Yes. There's a hormone. There's a hormone DHEA which starts to deplete after this age. So, but we only get to realize when we start seeing the wrinkles and fine lines and the droopiness, which is about 45, 46, is when we want a quick remedy.
Right.
So, ladies out there, please,
and
owe
we
this
didn't
to
realize
yourselves.
it started so much earlier.
Exactly. So it could be anything. If it's not making you happy, it's worthwhile. Come to VLCC, we'll do your analysis.
Yeah. So how do we, those of us who are over 25, how do we prevent hyperpigmentation?
The simplest way to do it is to use a good spectrum sunscreen.
Okay.
Yes.
Okay. So just sunscreen.
And also, a lot of people don't know UV lights like above us also causes it. Wow. It's not you just have to be under the sun.
Okay.
Even at home, after your cleansing, toning, moisturizing in the morning, please use a sunscreen.
Yeah.
Yes.
Even when it's overcast, like a lot of people will assume
totally.
It's just
even
direct
if it's
sun.
even if it's cloudy, use a sunscreen.
Even for us, people who have a lot of melanin.
Yes. Those are also
African
sensitive
origin.
skin. Yes.
Yeah. Okay. So let's now get to the treatment part, because you said the treatment is not just something
it is customized. Yeah.
Okay. So talk about the customization.
We have various treatments. We do peels of various categories. Some are very lunchtime peels. You can just do a peel and just look beautiful instant, but some are very treatment-based peels, which of course stay with you a little longer time on the face. Yeah. Then there is abrasion treatments that we do with microdermabrasions, microneedlings. So yeah.
Oh, you said needles. I said ooh.
No, it's nothing invasive. It's basically like how you do sandpaper polish.
Okay.
So it's that polish for the skin.
Yeah.
So also there are lasers, there's pulse light, there's other treatment facials that you do, but my personal favorite is peels and microneedling.
Yeah. And again, this is subject to coming in, getting the analysis.
Correct, and also understanding the skin here. It's very beautiful. It's very healthy. but also a lot of females don't understand it's very sensitive at the same time. So they just sometimes overlook it and come with when it is slightly more dense.
Right.
So yeah, by itself the melanins are not going to get uniform. It needs exfoliation. So it needs that much time. So the longer you take, the more treatments you'll need.
Yeah.
So it's better to tackle it at the early stages.
So does it affect women more than men, or is it
Not
what's
at
the
all.
gender
It's for
balance?
both genders. As I told you, melasma is of course the pregnancy part of it. So it's women. Age spot also. Age spot is both men and women, but older. And post-inflammatory hyperpigmentation is also for both, because it could be any skin injury, it could be any hormonal change or a reaction to a medicine. And sun, of course, men are also in the sun.
Yeah, and we'll be doing a demonstration later on.
Yes, we will.
So we can see, you know, some of the treatment options. Are you seeing that you've been in this industry for quite a while?
Yes.
Are you seeing Kenyans are more likely to come in and seek help now for some of these skin issues than before?
No, it has always been there. I think the exposure has not been there.
Right.
You see, so because of the melanin color of the skin, they feel it's just natural. But when we do analysis, we make them understand the difference in, you know, what a nose could look like, or a chin, or a cheek, or a forehead. So we try and make them understand that this is the various tones of the skin.
Yeah.
So we need to uniform it.
Right.
Yes.
Okay. All right. Well, I'm looking forward to see the
Yes,
demonstration and some of the treatments.
So we'll start with the
available here.
analysis. So
Okay.
I make you understand how we introduce a client to his or her condition.
Okay.
We definitely know when we look at the face, but I need my guest to be comfortable with whatever treatment we are going to follow with.
Right.
Yes.
Okay, so we're going to take just a short break, but we'll be back to learn more about hyperpigmentation and some of the treatments available. This is the Skin Therapy Show. Stay tuned. All right, so it's time now for us to see one of the treatments that are offered here at the VLCC. Remember, we've been talking about hyperpigmentation, and the lovely Esther here is going to take us through. We've got our lovely model as well, all set up to go. So Esther, welcome to the Skin Therapy Show.
Thank you.
Thank you so much for having us here today. So tell us, before we begin, what treatment are we going to be doing here?
My name is Esther. I'm a VLCC skin therapist. Today we are going to do hyperpigmentation treatment called microneedling.
Micro?
Needling.
Okay.
Yes.
Okay, that involves needles.
Yes.
Okay.
Yeah.
All right. So we'll be watching as you begin. So maybe you can just start and tell us what you're doing as you go along.
Okay. So first we start with cleansing the face to make sure it's clean. And for treatment, we normally use cold water.
Okay.
For how we are doing both the neck and full face.
And full face.
Yeah.
Okay.
Yeah. Most of the microneedling we do both face and the neck.
Okay.
Yeah.
And for example, for the model that we have here today, how many treatments would she need in order to see results?
That one the counselor has been at. That one the counselor has to advise, but minimum start from 4 to 6.
4 to 6 sessions.
Yes.
Over a period of how long?
2 weeks
Okay.
for another treatment, but it depends. It can go to 2 weeks or 1 hour.
Okay.
1 week.
Okay.
Yeah. So after you cleanse, you tone
Okay.
with a damp cotton. So after that, I need to dry the face completely.
Okay.
Before I apply serum.
Maybe you can just talk us through the steps. So after the serum, what comes next?
After the serum, you start the microneedling.
Okay.
Then after microneedling, massage a little bit. Then you apply the cooling mask.
Okay.
Yes. So we normally start with this area. This go forehead, then we finish with the neck.
Okay.
Yeah. So with the serum, you apply the area you are doing first. You can't apply the whole face. Yeah.
Oh, because you're going in sections.
Yeah, section.
Okay.
Yeah.
So how many centimeters is that?
It depends with the client. You'll keep on asking the
Oh,
client.
if they're feeling comfortable.
Yeah.
Okay.
So I'll start the micro needling. It's okay. You're feeling the needles? It's too much. Okay.
All right. I'm going to leave you to it. I can't see the needle, so I'm okay for now, but I don't know how I'd feel if that was her on the table. But of course, one of the treatments offered here at the VLCC for hyperpigmentation.
Yeah.
Esther is going to continue. She started one section of the model's face, and she's going to continue to show you the entire process and treatment. And of course, I'm going to head back and talk a little bit more with Pooja about this treatment and results, what is expected, and more about hyperpigmentation. Stay tuned. This is the Skin Therapy Show. Welcome back to the Skin Therapy Show. Remember, we're always looking to give you skin care tips that are going to help you in your everyday life. And we just saw that in our demonstration that was just featured there. Today we've been talking about hyperpigmentation. So maybe you can tell us a little bit about the treatment that you just did. Is specifically targeted at what?
It's mainly targeted to improve the tone and the texture of the skin.
Right.
Yeah.
We haven't talked much about lifestyle and how that
Yes.
affects. We talked a little bit about maybe genetics, but lifestyle,
Yes,
how does that affect our skin?
Generally, they say what you eat shows on your face.
Okay.
Yeah. So, not just for hyperpigmentation, for anything, so that we live a wellness life. Water, greens, no processed foods, limit your red meats, alcohol, try to limit smoking or not do it at all, which is what I would advise.
Yeah.
A lot of hydration for the body, which is water, which I said the first point.
Yeah.
So you basically need to feed your body well, treat it like a temple, so that overall, not just the face, is wellness.
Yeah, skincare is healthcare. Really,
Exactly.
you're taking care of your overall health.
Yes.
For someone who might be experiencing hyperpigmentation of any of the variants that we've talked about today,
Yes,
and they're
true.
thinking, well, maybe if I just stop smoking, you know,
Yes.
I'll be fine. It'll go away. Does it go
But
away on its own?
the past, what has affected the skin, will not just go away. Maybe it won't deteriorate. You will still need to work on the affected areas with smoking, like dark lips and some patches on the face. But yes, it can be controlled further. Yeah. So it will not just go away. It doesn't just happen, because the excess melanin is already there in your skin, which has to be exfoliated.
Right.
Yes.
And how often a treatment like what we just did, how often should that type of treatment?
Again,
for
as I
someone
said, it depends on the skin, the age group, the healthiness of the skin. A lot of people have been using over-the-counter products which make their skin very sensitive and red, in a layman's language. So once a month or maybe once in 2 months. But if it's a good, healthy, young skin, we are treating once in 15 days also.
once in 15 days
Yes,
for the exfoliation.
yes. Depends on the level of intensity we do with the treatment.
Earlier we were talking about, you know, when you reach your mid-40s and you're seeing some problems that have been developing over time, and you're looking for that quick fix. How
Quick
long
fix.
does a treatment typically take?
Even with the single session that you do here, which the downtime is about a week, 10 days, you will see a major difference. You need to you owe yourself that much. You need to look after yourself.
Yeah.
Yeah, but you'll be very happy with the treatment.
With the treatment,
Yes.
even if it takes 9 months.
Not necessarily. That's a aggressive case I'm talking about.
Yeah.
But it can take even as less as 1 or 2 months.
Yeah.
Yeah.
So the best thing if someone starts to notice changes in their
Yes,
skin.
just be honest with yourself and own up to the condition. Not suppress it or camouflage with makeup. Of course, that is
That's
a
our
quick
first-
fix.
yeah, especially for women,
But
that's
own up to it and walk into our place.
Yeah, and there's so many beauty products available out there
Yes.
today. Everyone is telling you that they'll treat you
True.
and they'll cure you
Yes.
and trying to sell you
Correct.
something. So how do you navigate those waters?
They are seriously very good products in the market, but they will not treat you, as I said. They'll maintain your present condition or give you suppleness, hydration, like the wrinkle creams or those brightening packs. Those things, yeah, they are good for a person who does not have this condition and somebody who's tackling with aging problems. Those ones. But hyperpigmentation, even over the counter, if you use these products, will go away till the time you are using it, but it will come back because nobody has been told how to use them properly and what precautions to take. So it's better to visit a professional.
Yeah, it's just kind of like a painkiller,
Yes.
alleviates the pain,
Yes.
but not cures the
Totally,
condition.
yes. It
Yeah.
has to come out from the roots. So yeah.
So we've talked about different types of treatments for different types of hyperpigmentation. In terms of side effects that people might be concerned about. For example, I'm not very well versed in chemical peels, but what I know is that your skin peels
Yes.
at some point.
There are different kind of peels, and because of the chemical formula to it, they are called chemical peels. But there's really nothing to worry about, as you see Google and YouTube's the
Google
if it's
is
done
scary.
professionally, it's one of my favorite treatments.
Okay.
And there are down times like you peel for 1 or 2 days. It could be a mild peeling, but if you're told how to protect your skin, you may not even see it on your skin.
Okay.
The cream just absorbs it. So for others, it could take about 4-5 days peeling if you have done aggressive peeling. So it's not something which you are caught unaware, because we prepare the guest also
On the
as to
aftercare.
yes, and I also make it a point if they don't have any immediate important meetings, so we plan accordingly. So that's why I say procedures are very customized, not just from taking you to the therapy room, but from the one-to-one where we are consulting them. And
I'm going to take your final thoughts on
Yes.
what we've been talking about today, hyperpigmentation of the skin, and someone watching from home who might be a little bit hesitant to seek help.
Just get to know your skin better. It's always best to be friends with your body, and as I have been telling you all the time, to own up to it. Anybody most welcome watching Skin Therapy Show to come to our center. We'll do a free analysis.
Oh, you do you?
Yes,
See,
for
you
your
mentioned that.
viewership.
Thank you.
And they can take tips from us. If they are comfortable, we'll be very happy to treat their skin.
Yeah.
Yes.
Yeah. So thank you so much for
Welcome,
welcoming us
Joey.
here, showing
I
us what it is that you do, and hopefully more people who are
Yes.
watching will be encouraged to come and get an analysis and also get the help that they need. The help is
Thank
out
you too.
there, guys.
Thank you. Thank you too.
Remember, taking care of your skin is taking care of your overall health, and that's what we
Yes.
aim to do here on the Skin Therapy Show. If you have any questions, they can be addressed in shows in the future. So you can go ahead and send them into our social media pages. We are on Twitter, Facebook, and Instagram at the Skin Therapy Show. If you want to DM me at Joey_Mutengi, you can do that as well. We want to say thank you so much for making time to watch the show today, and I hope that you learned something. Until next time, take care of yourself.